When is surgery a good option? If your dog has been diagnosed with cancer, when is it time to have a surgical procedure? Let me throw that to you, Dr. Dressler in Hawaii.
Well, one of the most basic ways of dealing with cancer is removal of cancer cells. Therefore, whenever we can remove cancer cells, it's a good idea. Now, how do you go about removing cancer cells? There's a lot of different ways of dealing with cancer cells. Surgery is a way to get cancer cells out of the body. The best time to use surgery is when we can get the cancer cells and remove them entirely from the dog's body, completely. In an ideal scenario, if we can accomplish that, we have just achieved a cure. And that's the best case scenario. So when we're sure that we can remove the cancer cells, it makes a lot of sense to do so. The problem, though, is that the situation gets much more complicated than just that when we're dealing with dog cancer. Because when we're talking about malignancies, and these are cancer cells that tend to spread, sometimes spreading to the extent that we don't know where they are, or if they've spread, but we just think that they've spread because we know that those cancers spread, then it becomes tricky. In those cases, it makes a lot of sense to do surgery when there is a real benefit to the dog. And many times we'll call this a palliative surgery, meaning we're just trying to make things better, or a debulking surgery, which means that we want to sort of take a tumor or take a growth away so that we can give relief of pain, or that we can improve life quality because we can, say, move around, whereas before we couldn't, or we can now eat, whereas before we couldn't, or if it was bleeding or acting like a source of infection or discomfort, then we could do a palliative type of surgery and improve our dog's life quality, make our dog happier, feel better. But we kind of understand that in some of these cases, with the palliative surgery, we may be having to look at a recurrence because we couldn't get all of the cells out, and we're going to need to start thinking of other ways to deal with those cancer cells.
Dr. Ettinger, when do you recommend doing surgery?
Well, it's a complicated question, but I think a really important one. I think if your dog has a lump or bump, a mass on it, an important first step is to have your veterinarian aspirate it. And that's just a non-invasive, non-surgical procedure where they're just going to extract a few cells and have them looked at under the microscope. And in general, that's going to be able to tell you whether it's a benign mass or a malignant mass. A benign mass is easier because the surgery doesn't have to be as big. But if you have a malignant mass, a mast cell tumor, or a soft tissue sarcoma, in addition to just removing the visible mass, you need to have your surgeon or your veterinarian remove 2 to 3 centimeters around that tumor. And so really knowing what type of tumor you're dealing with before that first surgery is super important, because your best chance for, the tumor to be removed is on that first surgery. If that is not a complete surgery, meaning someone looks at the cells under the microscope and they see cancer cells at the cut edge, your dog's going to need to go back in for a second surgery. So we want to try to get everything out the first time. And so I think really knowing what that lump or bump is before your dog gets anesthetized and that mass gets removed is super important. And so whether they need an aspirate or even a small incisional biopsy where they're just taking a little core of tissue, it's really important because, again, we want to make sure that we can try to remove the entire mass with one surgery if possible. Just one quick thing to add, if your dog needs a second surgery, it doesn't mean that that's, it's not going to definitely work or anything like that. But again, we definitely want to try to make the first surgery as curative as possible or as big as possible, and knowing what your dog's mass is before it goes to surgery is very important for a good outcome.
Dr. Ettinger in New York, Dr. Dressler in Hawaii, thank you so much.
Thanks.